So Golani Gold is actually a word that most of you have coined when you'll see me struggling, looking for patients' vision potential, and in many cases even beyond 2020. My biggest attitude teaching that I have for all of you doctors, surgeons, eye surgeons is don't just stop at the patient's available vision or potential that someone else has recommended to you. Look for it yourself and look for it to a level that is so deep. It's like I tell patients, I want every drop you have. So as you've seen me, when patients arrive here from all over the world with different complexities, complications that they've had elsewhere, I struggle to find their vision potential. I literally disregard their difficulties, complexities, or if their surgeons have written that nothing can be done for them. So you have to look for potential. I call it literally as winning a battle. It's like I'm not going to be defeated. I want to look for it. I refract them myself. With all the technologies we have in our institute, some of the best in the world, we look for vision in different directions. And I try to get, even if I found 20/20, I want more than that. If they cannot see, I want to know at least how much will they see. So there are some patients who come to me who are amblyopic or lazy eye, or who've had such severe complications of Lasik or early keratotomy or keratoconus or cataract surgery that they will never see 20/20 because that cornea has been impacted and damaged. But I still refract from there to see, okay, they have come to me with 2400 vision, which is just the big E that they can read. Even if they can see 4 lines more, and that is nowhere close to 20/20. But for them, those 4 lines are night and day. That's what I call potential, the gold. So even in those cases, I don't say nothing can be done. I actually let them perceive it. I show them the vision, those 4 lines, and I say, is this worth doing surgery, spending money, and going through a healing process? And then I let them say, from the scale of 1 to 10. And many of them go, Doc, this is 10 on 10. This is 8 on 10. This is life-changing for me. Boom. I'm ready then to perform for them. So that's the goal I'm picking up in patients who are not 20/20. In patients who are sent to me and told nothing can be done, again, as I said, I disregard that statement. I have notes and charts and diagnostics and scans from their surgeons who refer these patients or the patients I brought them with them. And I just basically sit down and I look more and more for potential. I just don't want to believe that they can't see unless I get defeated and I cannot make them see with my testings. And that means they don't deserve any surgery. And that's so rare here because of my fight. I am blessed. I was born with 20/10 vision, which is 2 lines better than 20/20. So I never believed that 20/20 is perfection. Best vision potential, BVP, is what I look for in everyone. So Golani Gold, in other words, in normal people, I try to look for better than 20/20 potential. In people with complications when they come here, or people with complexities or not a candidates, I try to see what potential do they have, the best. And then those who are even lazy-eyed or cannot see 20/20, I still want to know that the potential I have found, is it worth doing surgery ethically for them, letting them judge for me. So it's very vital because only when you find the gold, the potential of vision, will you be able to perform the surgery at that level. And then yes, you have to be an excellent surgeon, aiming for perfection. Yes, you're human, but you have to aim for perfection because only when your surgery is perfect at every level, anatomically, surgically, optically, using the proper lens implants if needed, or laser techniques, algorithm, will you land at that potential. So you cannot let the patient down. You have shown them the potential, the gold. Now you have to go and get the gold for them. So that should be the aim and attitude of every eye surgeon, every optometrist, every eye doctor, optician, every level of eye care provider. So go look for the gold in every patient you can. Bring them to the best they could ever see. Dr. Golani.